shitty buses.
Hi, my name is Kelsey Ciszewski, and I'm a nursing student at the University of Michigan. I'm reporting on one of my patients I had during clinical at Heartland. This patient is a 73-year-old Caucasian female. She's married and is currently retired, but she's previously worked as a secretary in an office. Previously, the patient had been admitted to St. Joseph Mercy Hospital for chemotherapy treatment, but is currently at Heartland for rehabilitation to maintain her strength. Patient's chief complaint is currently difficulty breathing, which affects her at all times. However, patient states that it is mostly just an annoyance to her because she has been dealing with this issue for so long she's grown accustomed to it. Past medical history of the patient includes a diagnosis of stage 3 lung cancer, for which she receives chemotherapy and radiation treatment. Patient also has been diagnosed with chronic obstructive pulmonary disease as well as atrial fibrillation hypertension. There is no family history of cancer. However, the patient's mother has also had hypertension. Patient has no known drug allergies. Currently, she's taking 5-FU for chemotherapy as well as amlodipine and lisinopril for her hypertension. The health habits of the patient are that she appears to be thin but a weak individual. She spends most of her entire day in either her chair or her bed, but takes occasional short walks, and she does not need an assisting device to do so. She does not use tobacco or alcohol, but she likes to have coffee in the morning. Patient states that there are no abnormalities in her sleep patterns, and she also states that she eats less frequently than she should and eats smaller meals. To pass the time, patient uses the computer to play card games. The patient identifies herself as Christian but does not attend services anymore. She states that she has a lot of support from her husband, who is with her most of the time at Heartland, and she occasionally has contact with her children. When taking her vitals, temperature was unable to be assessed due to limitations at Heartland, but it would be expected to be normal. Blood pressure was 134/68, her pulse was 62 beats per minute, and her respirations were 22 beats per minute. The patient rated her pain as a 4 on a scale of 1 to 10. The first system assessed was respiratory. Patient has been experiencing dyspnea for about 6 months. This is alleviated by her medication, rest, and by taking it easy. Aggravating factors include overworking herself and strenuous activities. Patient denies pain from this problem, however. In this exam, there is no visible distress upon breathing. Tactile phragmitis was found upon palpation, indicating consolidation. All fields were auscultated, and a wheeze was heard. There was a positive egophony, bronchophony, and whispered pectoriloquy, also indicating consolidation in her right lower lobe. The second system assessed was cardiovascular due to her hypertension. Patient has had hypertension for 10 years, but she states no chest pain, and there are no aggravating or alleviating factors because the medication is handling the issue. No heaves or lifts were inspected or palpated. Upon auscultation, irregular S1 and S2 were heard, and there was no S3 or S4 sounds. Other pertinent systems to assess on this patient would be the peripheral vascular and neurological. The peripheral vascular assessment would be important to assess due to the patient's diagnosis of hypertension. The Journal of Human Hypertension notes the associative factor of hypertension and peripheral vascular disease. Assessing the system would allow for this disease to be caught and treated if present. Another pertinent system due to the chemotherapy treatments patient has been receiving would be neurological. According to the Journal of the Peripheral Vascular System, cancer therapies can cause neurotoxic side effects. This cannot be treated, so it's important to assess the patient's neurological abilities to determine whether she is experiencing